Robotic hysterectomy is using the robotic platform to perform a hysterectomy procedure. A hysterectomy can be a total hysterectomy where we remove the uterus as well as the neck of the womb, or it can be a subtotal hysterectomy where the neck of the womb is left behind and the uterus and its body is removed. Often we combine this with a procedure called bilateral salpingo oophorectomy, which means removal of both sides, tubes and ovaries. This can also be unilateral, where we preserve one side's tube and ovary while removing the other side. Sometimes we only remove the tube by doing bilateral salpingectomy and preserving the ovaries. If we are removing the ovaries, it is known as oophorectomy. There are various indications for a woman requiring a hysterectomy. Some of these include uterine fibroids, endometriosis, pelvic pain, uterine adenomyosis, large cysts in the ovary, and indeed cancerous conditions like a cancer to the neck of the womb or to the lining of the womb, what we call uterine or endometrial cancer. Now, the reason why robotic hysterectomy has become more and more popular and is now almost becoming the standard of care for minimal access hysterectomy is because of its advantage in doing very complex surgical procedures using the minimal access approach. We can do this surgery with minimal scarring, with tiny keyhole incisions, and even patients who are very elderly or who have got multiple comorbidities can have this surgery because we can do this surgery with very low intra-abdominal pressures. This is really helpful for patients who have got breathing problems or who are very large and very obese, and hence it is potentially a game changer the way we do this surgery. Using the robotic platform, we use very precise tools which are operated by us, but they are articulated using a robotic platform, and hence we can use very precise movement to do these surgeries very, very carefully. The outcome for these surgeries are excellent. Usually patients can go home after a robotic hysterectomy either later in the same day or at the most the next day. The blood loss is very minimal, the scarring is very minimal, and the recovery is excellent. I've had patients who have gone for major outdoor activities even a few days after having what was previously a very complex and radical surgery. Patients give excellent feedback having had a robotic surgery, and they often ask me, did I have a surgery at all? It is definitely a tool that we use more and more often in doing very complex hysterectomies because of the platform allowing us to visualize organs very, very magnified in a more precise way. All these reasons why robotic hysterectomy is almost becoming the standard of care in terms of doing complex hysterectomy in women with different complex gynecological problems.